I'd like now to introduce Val Fell, who is our next speaker. Val barely needs any introduction. You may have seen her on TV, on the drum, on multiple avenues as a spokesperson for older people, and who's not afraid to say the things that need to be said about what we're needing to see in this sector. So Val, I'd really welcome you. She also is on the Council of Elders with Tom Calmer, who many of you will have seen in our first episode, I was about to say, our first event which we ran, because he's also been a really strong promoter and supporter and is also on a Council of Elders. So Val, please welcome to the stage and share with us your views and values about advanced practice nurses.
I've come up much more quickly than I thought. I thought I was in a panel later on. Never mind. I'm not the only person coming from the Council of Elders who has an interest in gerontology, because apart from Tom, we have Gillian Lewin from Western Australia, who is also a doctor in gerontology and is on the Council of Elders. And actually, we are working together on a subgroup which talks about ageing well. And we'll be working on that quite a lot during the next 12 months on what stages, etc., various things need to happen. So that will, we're going to be meeting once a month next year, as we have been doing this year, but we now have to go to Canberra every second month. So it's quite a job. But thank you very much, Alison, for your introduction today, because you talk about things that I've talked about for years. And for those who haven't met me before or haven't heard me speak before, you will know that every conference I have gone to for the last at least 5 years has been nothing will work unless we have the right people with the right training in the right place at the right time, with the right amount of remuneration and reward for personal development. In other words, without a well-trained, diverse workforce, we won't get anywhere. And that's where the gerontology people come into it, because I don't hear in most of the things that I listen to about the differences in the nurses that are needed in aged care. And when we talk about aged care, I'm not talking about just about supported home and residential care. I'm talking about the primary health care network as well, and the hospital system and the training, in which I'm also involved. But it's very important that we recognise the fact that this is not going to happen overnight. We won't get the right people in the right place unless we change the community attitude towards old age. There's a stigma of old age, which is quite frequently made out as a laughing matter, and I'll give you an example of that in a moment. But people do not think about pensioners and old people as people. They're just old things. You don't take any notice of them. They've all passed their use-by date, and so we don't have to worry about them anymore. I mean, we do have examples of people being diagnosed with younger onset dementia at the age of 49 and told to go home and prepare to die, get their affairs in order and just wait for old age. Fortunately, that attitude is changing a bit now. But generally, old age is something people don't want to think about. So we have to make the upcoming generation think more clearly and be accustomed to knowing that people in the aged care bracket, in the various stages of aged care, all have something to offer to those who are coming behind them. I'll share my little joke, and this is actually true about ageism and where, the view of ageism is in the general population. I went to a dinner recently, and before the dinner, it was for a retirement dinner, so the person retiring was over 65, so a lot of the people there were over 65. And the waiter came along and said to the lady sitting next to me and myself, "Would you ladies like a glass of wine before dinner?" And Linda said, "Oh, yes, thank you. I'll have a glass of wine." And the waiter went through the whole thing, red or white, still or sparkling, etc. Poured her wine. And then he looked at me. He looked very carefully at me. And then he said, and would you like a cup of tea? That is true. That happened to me. And I said, no, thank you. I'll have a glass of wine. And he immediately said, white. And I said, no, I'll have a glass of red. But that's ageism, real ageism. And that is out there in the community. And so that's something that we have to get rid of as well. Like recently I was asked if I could still read, but still, I'm only 93. I've still got 7 years to go to catch my mother. And so I know what it's like to be old. I know what it's like to be looked at as being old, and people sort of talking to you as if you cannot understand a word I am saying. So there are problems. Before we start with the nursing, we've got to get rid of the stigma of age. And there's one way to do that. I'll just touch on it briefly because I've other things to say about the nursing side of things. And that is, we have to start with intergenerational education. And I would like all of you to think about that, because that can start in primary schools. If you started in primary schools, carry it all the way through. By the time you get to secondary schools and year 11, you might have children who, when offered a position in an aged care, might not think, oh, I'm not going there. They might think, oh, fine, I'll go there. I know a lot of old people who are nice old people, and they will change their attitude. And that's where we have to start. We have to carry that through and teach graduates coming out of the university, including nurses, how to communicate with old people. Communication is very much a part of nursing practice. So
thank you, Val. That's fantastic.
Get off my hobby horse and say that I had to look up the word gerontology, because I've come across all kinds of things since I have, changed from a statistician to being a carer of people with dementia. And I hadn't come across this very much until today when I looked it up, and I thought, that's the kind of thing that we need, because that fills some of the gaps with, I was saying, the right people with the right training. There are so many different avenues. There are some I would have added to your list. So I've read through your whole list of your mission, and that's palliative care and end-of-life care. They're two things that I haven't seen written there. You talk about economic people and you talk about everybody else, but I haven't seen palliative care. And the word holistic does appear, fortunately. I think that's one of the things that you have to understand. The only other thing I would have commented on as far as the things that you list is concerned is First Nations is not actually mentioned as a separate identity, which I think it needs to be. It's you need to be practiced in that as much as in, need to know about the culture of the First Nations group as well. But fitting it into a primary health system and an aged care, my aged care system is going to be difficult. And I don't know if you are aware, but there was an item in the Aged Care Royal Commission about regional stewardship. In other words, getting aged care and the various health departments to work more holistically together. And there is some research going on at the moment about that, which will only be help in the future. I know that there's a pilot program going on in this particular area, and he is talking to as many people as he can to gather as much information as he can to make sure that the whole system is under consideration, not just various outlets of it. I mean, at the moment, of course, with the Council of Elders, by the way, I am a member of the Council of Elders, but what I am saying now, I'm not saying on behalf of the Council of Elders, I'm just speaking as a person who happens to be a member of the Council of Elders. Sometimes I don't agree with it, so we'll see. But we are working very hard, and we have a few changes coming in the next 12 months, and we've got even a lot more work to do because the supported home program is well and truly being developed, and then we have the residential program to look at, and then we have all those other things like we're not there just to look at dementia patients in old age care, etc. We are there to look at people who are in the community, who are homeless, who are, sort of have other problems, who are disabled, etc., etc. There are a whole lot of avenues that we have to look at.
Thank you, Val. As you said, getting the right skills and the right people at the right time is part of our challenge. So if you don't mind, I might use that as a link to our next speakers, if that's okay.
Yeah.
Thank you so much. It's always so good to get the consumer perspective and anything that you can bring us about making sure that we're keeping it grounded about what's needed from people.
Actually, I'm a participant in the research program with Henry Bodati at the moment on aging well.
Demonstrating it so thoroughly well. So thank you so much.